Hello and welcome to the Hertfordshire Young People's Health and Wellbeing Survey webinar. I'm Jen Beer, I'm the Health Improvement Lead for Children and Young People in the Public Health team at Hertfordshire County Council. This webinar is for any professional in Hertfordshire that works with or for young people. The aim of the webinar is to share some of the key results from the new Young People's Health and Wellbeing Survey, which was undertaken in November 2020. This survey has been developed in partnership by our Children and Young People's team in the Public Health team, our Health Intelligence team, Hertfordshire County Council Services for Young People, and Hertfordshire NHS Community Trust. We also had input on which questions to ask from a wide range of other partners, so I want to thank them for their contributions. Now, we know many professionals are incredibly busy at the moment and it's a difficult time. So to make it as easy as possible for you, you can either watch this webinar through in full, and we've tried to keep it as concise as possible, or you can watch it section by section so that you can look at the part that's most relevant to you. Now, the Young People's Health and Wellbeing Survey covers a number of different topics. It includes mental health and wellbeing, sexual health, physical activity and healthy eating, drugs, alcohol and smoking, and personal safety. You can split the data as well by a number of different demographic markers, including age, district, gender and ethnicity. 12,923 young people took the time to complete this survey, so it's incredibly important that we listen to what they have to say and we use this information to ensure we're delivering the right things in the right way, and also to ensure we're adapting things so that no child's needs are left unmet. I'd like to take this opportunity to thank every young person that took the time to complete the survey, and also the 42 schools that promoted the survey to their pupils. If once you've watched the survey you have any questions or feedback, please don't hesitate to contact us. Our email address is yphws@hertfordshire.gov.uk. Thanks very much.
I think the Hertfordshire Young People's Health and Wellbeing Survey is important because it helps commissioners and providers across the county to know how best to support and engage with young people like me. I think it's important that the councillors listen to me because young people have great ideas, and although we're young, we can share ideas that really affect everyone's futures in a positive way. If I was a councillor, I would listen to young people because, like I just said, we have amazing ideas and they need to be shared. Overall, a third of young people felt that their well-being has become worse since COVID-19. Young people's well-being has become worse because of the isolation from their friends and for losing loved ones, and just from worrying about losing loved ones. My best friend's mum died of diabetes because she couldn't find a place in the hospital because it's full of COVID-19 people. It made her feel sad because she heard she lost her mum, and the grief is getting to her as she's isolating as well. Girls' well-being appears to be more affected than boys, with 39% of girls rating their well-being as lower since COVID, compared with 25% of boys. 52% of young people identifying as gay, lesbian or bisexual rated their well-being as worse since COVID.
The biggest worries for young people currently are schoolwork, their mental health, their appearance, COVID-19 and loneliness. I think the biggest worry that young people have in this current moment is probably COVID-19, mainly for the fact that many people have relatives that suffer and might, pass on these symptoms and might have to go to hospital and may even die. And I think the other worry is probably the isolation that COVID is inflicting. So many people have been placed in lockdowns and separated from their friends and family and just aren't able to connect to people. However, these kind of worries are normal, and it is okay to not be okay. But sometimes if worries become too big and start affecting your daily life, it can be helpful to talk to someone or ask for help. Self-help information and details and support available can be found online at justtalkhearts.org. Some common coping strategies for young people finding effective for managing worries include listening to or creating music and art, talking to friends and family, exercise and gaming. Personally, when I'm right in the moment, just trying to exercise with breathing and imagining the opposite colour that the worry seems to project often works for me. And in the long term, I try to imagine just making some art and some poetry just to express how I feel. Services for young people can help because other people just often need to know how you're feeling, and you can always get help from other people.
Physical activity levels have declined since COVID-19, as has eating fruit and vegetables. This is because of multiple factors, including less accessibility, such as no access to gyms or PE lessons, or no access to nature walks outside, as well as things like less motivation due to declining mental health and no incentive from PE teachers. Only a quarter of young people do the recommended amount of physical activity, 60 minutes or more for 5 days out of 7. We do less and less physical activity as we get older, and girls tend to do less than boys. Being active and eating healthily make a big difference not only to our physical health but also to our sense of well-being.
Most young people, 9 out of 10, do not smoke or vape. This is a lot lower than in the past, so before COVID. And at the Youth Council, we think this is because at home, you're not seeing your friends as much, so you're not receiving the same peer pressure that you were before, because you don't feel like when you're with your friends and they're smoking, you should be smoking too. Plus, at home, you can't hide smoking from people like your parents if you don't want them to find out. So, yeah, and it's harder to access things like cigarettes because of COVID, because you don't have the same freedom to go into shops, and it's like you have to wear a mask and stuff. 6% of young people have smoked once or twice, and 9% of people have vaped once or twice, but the majority don't continue with it.
Hello, I'm Jem Beer. I'm the Health Improvement Lead for Children and Young People in Hertfordshire's Public Health Team. We're going to be looking at the results of the Young People's Health and Wellbeing Survey, and in this particular section of the webinar, we'll be focusing on young people's mental health and well-being, and also touching upon their experiences of bullying. We'll start off by having a look at some of the data, but we're also going to have a quick look at some of the support and information that's available to address the issues that are arising for our young people. Mental health is so important. It underpins all areas of health and well-being. Without positive mental health, it can be really difficult for young people to engage in education, to build positive relationships with their peers, to engage in things like physical activity and healthy eating. And it can also leave them more likely to self-harm or to engage in risky behaviours like unsafe sex or drugs and alcohol. You'll have probably heard a lot in the media about the mental health impacts of COVID-19. And we felt it was really important to ask young people directly how they felt it had impacted on their well-being. Overall, 1/3 of our young people felt that their well-being had become worse since COVID-19, with girls being more affected than boys. Also, young people identifying as gay, lesbian or bisexual seem to be more affected as well. We also asked young people to rate their life satisfaction for us, with just over half of young people rating their happiness as high or very high, which was lower than we'd found when we asked the Health-Related Behaviour Questionnaire in 2018. We also found that just over a quarter rated their happiness as low, which was higher than we'd found in the survey in 2018. Additionally, young people identifying as gay, lesbian or bisexual were more likely to rate their happiness as low. So it certainly implies there may well have been a decline in well-being, and that this decline is even more pronounced in gay, lesbian and bisexual young people. We also asked young people whether they agreed with the statement, "It's okay for me to talk about my mental health." The majority of young people did agree with this statement, with 74% of males agreeing and 68% of females. This is really important because we know that there is stigma attached to mental health and well-being. So it's absolutely vital in terms of young people's health-seeking behaviours that they do feel it's okay to talk about their mental health. The proportion of North Hertfordshire students who responded with yes when asked if they agreed with that statement was actually much higher than the wider sample. And the proportion of young people identifying as Chinese who responded with yes was significantly lower than the wider sample. Also, the proportion of young people identifying as black was lower, although that difference wasn't statistically significant. It's really important to young people's mental health and well-being that they have sufficient coping strategies in place to deal with the challenges that occur in their daily lives. And the 5 things that young people are currently most worried about in Hertfordshire are schoolwork, their appearance, mental health, COVID-19 and loneliness. It's important to be aware of these things because young people often feel that their worries are very isolated, and in fact they're often more common than they realise they are. Now, coping strategies vary by gender. For girls, the most common coping strategies are listening to or playing music, talking to a friend, talking to a family member, followed by thinking of a solution on their own and creative activities such as art or drama. For boys, the most common coping strategies are playing computer games, listening to or playing music, talking to a friend or family member, followed by exercising. Concerningly, a substantial proportion of young people said they would do nothing if struggling to cope. That's 23% of girls and 17% of boys. Doing nothing can potentially place them at risk of developing mental ill health or going into crises. Another really important thing for young people to be aware of is the support and guidance that's available to them in terms of their mental health. And young people were asked to select 3 sources of support they would find most useful if they were struggling. By far the most common response was parents or carers. And this was particularly a common response for the younger students. Other very common responses were school, doctor, mental health clinic, one-to-one support and online support. The least popular source of support of the options that we presented was group work. It's incredibly important that young people know where to access support should they need it, and encouragingly, the majority of young people do feel that they know where to find mental health information or services, so just under 2/3. Of course, that does mean that we have around 1/3 of young people who either don't know where to find mental health information or services or are unsure, so there's still work that needs to be done. We also asked young people whether they had ever self-harmed, and 72% said that they had never self-harmed. Males were more likely than females to say they had never self-harmed. The group most likely to say that they had self-harmed were those who selected other for their gender, but it's really important to note that that's based on very small numbers, so only 160 of the participants actually selected other for their gender, so we can't draw any firm conclusions from that. Importantly, given the slightly different age range of the participants from this year's survey compared with 2018's survey, we can't really say that there's a significant increase in self-harm rates. I'm now going to talk briefly about some of the questions that we asked around bullying and school support. So 10% of young people said they're currently being bullied, and 46% have been bullied at school at some point, which is a slight increase from 43% in 2018. The bullying rate is higher for gay, lesbian or bisexual young people, significantly so, and 18% of young people have been bullied online. Young people were also asked whether their school is supportive of their emotional well-being. Just over 1/3 felt their school is supportive. 42% were unsure or they felt their school was somewhat supportive, and 21% didn't find their school supportive of their emotional well-being. Again, this was significantly higher for those selecting other as gender. Now, this slide just flags up some of the significant differences in terms of bullying that we found. So girls are less likely than boys to say that they've ever bullied someone, and young people describing themselves as Black or Chinese were more likely to say they'd ever bullied someone. Young people from the Watford area were also less likely to say they were currently being bullied than the wider sample. Young people describing their gender as other were more likely to say they were currently being bullied, and girls were more likely to be bullied online than boys. I want to end by just flagging up some of the useful information that you can access around mental health, well-being and bullying. So Just Talk is our sort of central hub for mental health information for young people, parents and professionals. On there you'll find self-help information, some e-learning, signposting information for support, and the resources are constantly updated based on research evidence and feedback For example, we recently added some body positivity guidance for schools in response to the fact that we've seen an increase in eating disorder referrals and that their appearance was a key worry for young people. We also have the Healthy Young Minds in Hearts website, which is a fantastic website full of information for professionals, particularly schools. You can also find details of educational psychology and integrated services for learning contacts for schools in the link that's provided. And services for young people, they provide brilliant support for lesbian, gay, bisexual and transgender young people. And we've noted throughout this presentation that they are at an increased risk potentially of self-harm and of some of the mental health challenges. In particular, there's a really good top tips leaflet on there which young people have developed for professionals. There's also lots of different support services out there to support young people. So we have the Chat Health text messaging service provided by our school nursing service. We have COOF online for 10 to 25-year-olds, Hearts Mind Network's helpline for 10 to 17-year-olds, and Always HPFT's free 24/7 helpline service as well. So hopefully, no matter what a young person's preferences are in terms of support avenues, there'll be something there for them. Thanks very much for your time.
Hello, I'm Rob Bacon, the Sexual Health Improvement Lead for Public Health Hertfordshire, and I'm going to give you an overview of the data that was collected regarding sexual health and drugs and alcohol from the Young People's Health and Wellbeing Survey. The survey was undertaken in November-December 2020, just prior to the most recent lockdown. COVID has meant that a number of services have had to operate differently and in some cases have reduced. Young people's habits will also have been impacted due to previous lockdowns, and we have to consider that because it may have changed people's behaviour. If you are looking for some basic information of local services across the county, Health in Hearts is a really good place, lots of different topics to do with health. Sexual health and drugs and alcohol have their own specific sections, but there's also the national websites as well. So Sexwise for sexual health, Talk to Frank for drugs and alcohol. Again, containing loads of good information and a really good starting point if you need any further support. Here are some other links for further information. For drugs and alcohol, CGL is our local provider. For sexual health, it's Sexual Health Hertfordshire. Services for young people also provide support through their access points, and they now have the texting service where young people can text a question and a youth worker will get in touch with them. And they can also order free condoms through that site as well. The data here shows that 41% of young people feel that there's pressure on other young people to have sex, and that has increased in Year 10 pupils since the last survey. And those perceptions do increase by age and are more pronounced in girls than boys. But a really key element here, and a really good message to get across to young people, especially around boundaries and consent and feeling good about healthy relationships, is that 90% of Year 10 pupils in Hertfordshire feel that it's okay to wait. Also, it's important to remember that faith and ethnicity can also influence attitudes around sex and relationships. Where young people access sex and relationship information is going to determine the accuracy and the quality of that information. So it's good to see that schools is a key source for young people. We also can see here that young people understand that a health professional in some capacity can provide support on contraception, testing for sexually transmitted infections, whether it be a doctor, a sexual health clinic or a pharmacy. Although 35% of boys think that most 16-year-olds have not had sex, that does leave a high percentage to think that majority of young people are having sex, and we do know that that's not actually true. So before undertaking any sex and relationship education, it's really good to have an accurate baseline, and also remembering the previous slides that the majority of young people think it's okay to wait. What is also positive here, both in young men and in young women, is that they understand the importance of condom as a method to prevent sexually transmitted infections and unplanned pregnancies. And the websites on the previous slides give information about condom use and also the condom demonstrations. We can see here that knowledge increases with age when it comes to how to access contraception and sexual health services, and that's really important. It's good to see that Year 10's knowledge has improved since the previous survey. But this information needs to be consistent throughout their school journey, but also when they leave school and then into college, university and the workplace, as this is when you're more likely to have your first sexual experience. Now we move on to smoking. So majority of young people in Hertfordshire, 90% have never smoked. Got a very small percentage of young people who smoke on a regular basis. When we look at vaping, more young people are vaping than they are smoking, and we do see a percentage that have tried it but no longer do so, so probably more so on an experimental basis. So if we have a look at this in more detail, you can see there are certain patterns here with heart smear where young people were less likely than the wider sample to have never smoked or vaped. And more positively, young people identifying Asian were less likely than the wider sample to have smoked and vaped. But there are differences between the Black and Chinese groups where they both were more likely to have smoked and vaped, with Black smokers wanting to carry on smoking. So it's an area where here is the message need to be targeted slightly differently towards those two groups if we were talking about how to give up, when to give up and what support's available. So now we move on to other drugs, and similar to sexual health, depending on where young people access their information from, will determine how the quality and the accuracy of that information. It's important that all those sources where young people do turn to, make sure they know what the local services are and how to refer. But positively, 91% of young people have never taken any drugs. And when it has been reported that they are, cannabis is still the most commonly used substance. And that's similar to patterns across the UK. We have started to see increases in other drugs, ecstasy, cocaine, ketamine, but it's difficult to draw any conclusions because we know drug use increases by age and older children have been included in this year's survey. If you're unfamiliar with any of these drugs, please make sure that you access the Frank website for further information. We can also see here the different places where young people obtain drugs, with school being the less likely. When we look at this in more detail, we can see that both gender and ethnicity can play a significant part in how and where young people access information if they had any concerns about drugs. You can also see here, similar to smoking and vaping, that heart smear has been highlighted as a particular area where more drugs were taken by young people in the last 3 months than any other areas. And actually, even though relatively small numbers, other drugs like heroin, steroids and psychoactive substances have been highlighted. So now we move on to alcohol, with the majority of young people, 72%, not having an alcoholic drink in the last 3 months. Do need to bear in mind there were some forms of lockdown restrictions prior to the survey, so access to alcohol might have been more difficult, especially if young people were more likely to be in the home. Of those who do drink though, 67% would like to keep drinking, with a smaller percentage wanting to support to give up. But frequency and the amount of drinking amongst young people who do drink is relatively low, so 39% not drinking alcohol on most typical days and 55% never binge drinking. The most common places where young people obtain alcohol were home or friends and relatives, and we do know that alcohol consumption which is supervised is less likely to result in any sort of high risk behaviours or binge drinking. So as we move on to looking in this in more detail, you can see again similar patterns in the heart smear area, with students responding with never when asked how often they had an alcoholic drink in the past 3 months was significantly lower than all the other areas. And also with the Chinese or Black young people who were more likely to binge drink on a daily basis compared to the wider sample. And again, if you remember, their smoking behaviour and vaping behaviour was also was higher. So is there particular high risk behaviours within this particular group that need to be addressed? Now, my final slide, just a reminder of the links to the local websites, which lists the various organisations that are available across the county. Please make sure you become familiar with these, click on the links, find out more information and what's available in your area. Thank you.
Hello, I'm Sue McCabe and I am a team leader with the Public Health Nursing 5 to 19 service, formerly known as school nursing, at Hertfordshire Community NHS Trust. We have had limited involvement with the youth survey as a result of staff needing to support the NHS COVID response. Moving forward, we will be working with our partners to promote the survey to schools and be available to advise schools on any health-related concerns identified by their survey results. During the pandemic and the associated lockdowns, sports and exercise facilities, as I'm sure you are aware, were not available, and as a result, people's eating and activity habits changed dramatically. It is well documented that healthy eating and exercise are important in promoting everyone's physical and emotional health and well-being. The youth survey asked young people about their intake of fruit and veg. 16% reported that they had 5 portions of fruit and veg the day before they completed the questionnaire. This is a significant reduction from 28% from data gathered in 2018. There was also a 1% increase in young people who identified that they didn't eat any fruit and veg. 27% of young people stated that they ate on average 3 portions a day. The youth survey identified significant differences in relation to the eating habits of varying groups and ethnic populations of young people. Young people can find lots of information to support them around healthy eating on our Health for Teens website. We also work quite closely with busybodies. Young people, their families, and other professionals can access their website for top tips and recipes that the whole family can get involved with. Young people can also contact a school nurse if they have any questions or would like any support via Chat Health, the SMS text messaging service for young people. Young people were also asked about how much time they spent doing physical activity. The results identified that boys were more likely to engage in exercise for 1 hour 4 to 5 times a week. Only 25% of young people reported they do 60 minutes of exercise 5 out of 7 days. A common response from the survey was that young people did 1 hour of activity 1 to 3 times a week. Year 13s reported the lowest level of physical activity per week, and again there were significant differences within varying ethnic groups, especially the Asian and Chinese. If young people are looking for activities to do outside of school, they can check out the Hearts Sports Partnership website, which has a range of information on sports activities, including those being run over the summer. Young people can access our Health for Teens website, which has useful information on exercise for young people. It also includes a quiz which young people can complete to find out what kind of exercise suits them. All young people can access advice from a school nurse by using the Chat Health SMS text messaging service. School nursing also has a young person's Instagram account, which young people can also access. Young people were also asked how they would describe their current weight. 58% described their weight as being just right. 11% described themselves as being overweight, with a higher percentage response being female. 9% described themselves as being underweight, with a higher response percentage being male. The youth survey has identified significant differences between young carers, gender, and locality in response to healthy weight. If any young person would like more information around healthy weight, please do get them to check out the Busybodies website. They also run a program specifically for young people, which has had a great response. From July 2021, there will be information on the Just Talk website about body positivity. Please also don't forget to check out the Health for Teens website or the Instagram account run by the School Nursing Service. If a child or young person is showing signs of eating disorder behaviours, they should go to their GP as soon as possible.
Hello, my name is Sarah Hobson-Riley and I'm the Deputy Head Teacher at the Reach Free School in Rickmansworth. We undertook the Young People's Health and Wellbeing Survey at our school and embedded it during our PSHE time, which was a great opportunity for pupils to engage in the survey and to find links as to what they were answering with our PSHE curriculum. The results that have come our way have been really insightful. We've been able to use the data to be able to compare to other schools and in particular break the data down and unpick particular year groups or particular concerns or gaps or things that we feel like we're doing well and be able to use that information to help plan ahead for our next year's curriculum. In particular, it's been a really good resource to be able to use post-COVID, returning from lockdown and being able to identify any needs that we particularly need to address in our next academic year. The survey was really easy to access and all of our pupils and young students in our sixth form were able to very easily log on and complete the survey within a decent amount of time. None of the questions were there to trip them up. They were very straightforward, very open questions, but a real opportunity for our pupils to get an insight and to be able to explore their own emotions and feelings about well-being and health, in particular during this difficult time with school lockdowns and closures.
Hi, my name's Annie Yu. I'm one of the public health analysts in Hertfordshire County Council, and I'm going to walk through how to use the interactive Young People Survey Report. So first off, I recommend you use one of the newer browsers like Microsoft Edge, Firefox, or Chrome, which is what I'm using. They typically load faster. It should work with Internet Explorer as well, but it might be slower and it may freeze a bit more often. There's some useful description at the beginning here on the structure of the report, but for now I'll just talk through them. And always good to note that for data protection reasons, all the values are rounded to the nearest 5, so bear that in mind while going through the report. Here on the sidebar, we have different themes in health like diet, smoking, alcohol, drug use, mental health and well-being, etc. If you click on each section, you'll be taken to it, and it will expand for you to see all the questions within that section. So for example, in mental health and well-being, they were asked about their well-being, worries, about coping, self-harm, and more. And you can click on any of these to skip to the relevant question in each relevant section. So let's go back to the top. Starting from the top, we've got a key theme section here, which is basically text summarizing some key statistics from most of these themes. And then following that, we've got a comparison section where we have a large collapsible table that contains these auto-generated sentences. For example, this one, describing what the differences are between groups. So we assess these significant differences by comparing confidence intervals between groups. Each tab is comparing between different groups. So for example, this one compares between compares each district to Hertfordshire. This one compares each year group to all year groups. This one compares each sex, so females or males, or other. And this one compares each ethnic group to all ethnic groups. So for example, if you're interested in decorum, you will expand on decorum, and then you'll see which themes are available. You'll see which question within each theme, and then you can expand finally to see what the actual comparison is. Each one will have its own sentence that basically just summarizes what the significant difference is. If there's a theme or question that isn't here, that means that there was no significant difference found, basically. So moving on, we've got a small section dedicated to each question of the survey. I'll skip to drug use, for example. Typically, each question or section has 4 tabs. It's got the summary tab, which is pretty the summary text is usually pretty basic. It might tell you how many people respond to the question and give you either the count or proportion of the most common response to the question. There's also a breakdown of all the significant differences found between groups. But to see these, you'll have to switch to the second tab, where it's basically the same structure as what we saw before, except it's specific to the question. So as you can see, the question is the same for all of these breakdowns. And you can expand within each group to see how each group is significantly different from others. So the third one is the graph tab, and there are two types of graphs in this report. This is the most common one. It's just a simple bar chart with confidence intervals. The confidence intervals can help inform you on how large the sample size is, since these graphs show proportion instead of actual counts, as you can see. You can click on these buttons at the top here to change between breakdowns. For example, if you want to compare between area, just click on that. And then as you'll see, the legend has updated with the districts. And now you can compare between districts. So you can do the same if you want to compare by sex, by ethnic group, and by age group or year group. You can also manually change the legend items. So for example, if I select sex again, you can also select any one of these other ones, including all responses. Yes. So the legend is interactive and you can use it this way, or you can just click on the button again to reset it to a particular breakdown. Okay, so lastly we have a table tab that shows you the raw counts. So now you have a table tab where for every response of this question, you've got the count, the percentage, and the lower and upper confidence interval. So this is done for each breakdown. So for each ethnic group, each district, each sex, and each year group. So to get to them, just click on these pages here to see all the breakdown groups. All right, so now let's get to another question that has a different plot type. For example, drugs taken. So for these types of questions, the respondent can choose more than one option. For these questions, we have different plots, and you might notice that there are more than one graph presented here. So like we have 3 tabs for 3 graphs in this question. So the count graph, pretty self-explanatory. It shows you how many respondents chose a particular response. There's a drop-down menu here if you want to see it by different groups, like a particular ethnic group like Asian, Black. As you can see, the counts update here. You can see that the counts are much smaller because it's broken down to smaller groups now. And then we have a proportion graph where it basically shows you the proportion of those that selected yes or no for each option. As you can see by the drop down here, this graph currently shows how each group responded to whether they've taken cannabis or not. If you click on that, you can see the other options here. So a list of all the options available for this question. And finally, you might get this plot that shows you the mean number of options ticked per group. From what I remember, I think these plots are only available for 2 or 3 questions, based off of whether they would be useful or not to present. Besides these differences, all the sections are structured the same way, and it's quite consistent. They all have the same 4 to 5 to maybe 6 tab format. There are a few questions in the demographics theme that don't have as many tabs. For example, like age, you only have 2. This is because it's mainly to show the demographics of the sample, so there's no comparison tab or much summary text because the graph says it all basically. But yes, otherwise, the rest of the report is pretty much the same format for each question. If you've got any questions or have issues to report, you can email the YPHWS email that is shown in the webinar details. Thank you for watching.
Hello, I'm Stephanie Villanueva, Senior Public Health Analyst, and I wanted to say thank you for watching the Hertfordshire Young People's Health and Wellbeing Survey webinar. This data, provides us with a wealth of knowledge about our secondary school young people here in Hertfordshire. It is such a fantastic resource, and I want to encourage all secondary schools to take part so we can build a more robust picture of the sorts of health issues that affect young people. This will in turn help all of us to make evidence-based, informed decisions about the work we either commission or deliver to ultimately help improve the well-being of young people by listening to what they have to say. Also, the schools with at least 60 pupils participating in the survey will receive their own comprehensive report, which compares their results to the Hertfordshire average. The next survey is due to take place at the end of the year, but in the meantime, if you have any questions or any feedback about the survey, please feel free to email us at yphws@hertfordshire.gov.uk.